If you have high blood pressure, pay attention because we are going to see what foods we can use and how best can we actually manage high blood pressure naturally at home without using these other pharmaceutical drugs that we always use. Yes, high blood pressure is actually it is a condition that comes because of lifestyle. It is a change because of lifestyle. What do you think we can change in our lifestyle that can really help us to manage our blood pressure at home? So with measurements, blood pressure, the normal blood pressure is when someone has 120 over 80. That is the systolic over diastolic. So that is the normal. And now, what happens when someone has maybe elevated high blood pressure? Elevated high blood pressure is when someone has 120 to 129 and maybe below 80 and below 80. It means that the diastolic down, it is below 80. 80 and below, that is the elevated blood pressure. Then we have what we call high blood pressure that most people are actually interested in and what we don't know. High blood pressure is someone having between 130 and 139. 130 and 139, that is high blood pressure. And high blood pressure has two stages now. It means that stage 1 is 139, sorry, 130 to 139. Then below, how many? Below 80 to 89, that is high blood pressure stage 1. Then high blood pressure stage 2 is when someone has 140 and plus over it means that if it is 90, then it is plus. So it is 140, 140 and plus over 90 and plus. So you're going to do this blood pressure checkup very well. It means that when you're doing blood pressure checkup, please be serious on it. Let not anyone mislead you. Do high blood pressure checkup when you're fine. Go to your nurse, go to your doctor, go to the clinic, go to the nearest clinic and do blood pressure checkup very well. We do not just do randomly that you have checked your blood pressure. I'm going to show you how best you can do it. Now, today I brought you the best foods that can help you to actually manage your blood pressure when you're actually at home. I want you to listen carefully, and by the end of the video, I'm actually going to show you what foods should you avoid because they also they increase the blood pressure. We're also going to bring about the meal plan to always help us to manage these non-communicable diseases. For those who are watching and following our videos, you realize that we have one mission of chasing away the non-communicable diseases, but naturally. So get a book, get a pen, write down these foods the way they are following each other. Feel free to share the video to your friend. Feel free to please tap that plus sign so that you can follow us. We are going to be bringing you more and more health education about the foods that you're supposed to always use every other time you want to manage what, especially when you are at home. So follow, like, share, and comment. Please comment down what you think we should always bring to your attention. So these are the foods that you must use when you have high blood pressure. Number 1, so I want to recommend oats. I want to recommend brown rice. Please get brown rice. Get millet. For those who don't normally use millet, use sorghum. Then ground nuts. Those are sorry. Those are ground nuts that do not have salt. Unsalted ground nuts and unsaturated ground nuts. Then for the case of fruits, I want you to use bananas, use oranges, I want you to use avocado, I want you to use berries. For those who can get watermelons and pawpaws. Why am I recommending all this? We are looking at basically what can we use that contains number 1, magnesium, we need selenium, and why do we need them? Another thing that we need is what we call omega-3. People, you are supposed to get omega-3 from fish. It is also another food that you're supposed to use, but not every other fish. Which fish can I recommend? I recommend salmon. I recommend salmon because it has the fish oil content that we require. So now, when you're using all these contents, let's say fish oil, you're using magnesium and maybe calcium and all those ingredients that we get from the foods that I mentioned. Why do we need them? We need them simply because number one, we look at our blood vessels. I want you to look at the blood vessels that are there and the difference. Yes, there is a clear one and the one that is the one for high blood pressure and the one that is showing normal pressure. So now you realize that we need to reduce number one on the cholesterol, not removing all the cholesterol because we need the cholesterol. Now, when we regulate the cholesterol, it means that our pressure is going to be fine. Number two, our blood vessels need to contract and relax at the same time so that blood flow can be right. So now, when magnesium is in our bodies, magnesium helps the blood vessels to relax so that they do not contract. It helps the blood vessels to relax. As simple as that. Those foods, their major purpose is that to make sure that our blood vessels contract and relax very well. Number two, to make sure that our cholesterol is balanced very well. To make sure that the blood flow in our system is actually also normal. Then, as long as you have controlled that, your blood pressure is actually very fine. What foods should we avoid, and what exactly should we avoid? Now, I want you to help yourself I also want to help you with this. Please do exercises. When you do exercises, there is what we call metabolism of the glucose that you took in your body. Number two, it also creates what we call fat burning. It makes the system very simple that when fat burning happens, cholesterol regulation becomes simpler, and that's how blood pressure is managed. Number three, please avoid raw salt. Actually, avoid salt. Just avoid white salt. Just avoid it because it increases blood pressure. Yes, it brings high blood pressure. Then avoid alcohol, please. Avoid alcohol and avoid smoking. We love you so much, and whoever can't get all of them, I have something better for you. For someone who thinks their blood pressure has moved to 200, your blood pressure has moved to 300, your pressure has moved past 140, 150, 160, please come for help because I have something that can really reverse it very well faster than we are supposed to do it. So the most ingredients that I mentioned, the most foods that I mentioned, if you can't get them by yourself, I have something that combines all those ingredients at once. You need ingredients like magnesium, you need ingredients like calcium, you need ingredients like resveratrol. They are very good for antioxidation, very good to maintain your high blood pressure. The fish oil that I talked about, omega-3, most of us are using omega-6 instead of omega-3. You need omega-3 and specifically 1000 milligrams. If it is not that, please, you are not treating the high blood pressure. So contact me, the number is in the bio, so I can help you deliver it wherever you are. But high blood pressure can be treated. I know you're using atenolol, you're using any difedipine or whatever that you're using today. Please don't stop it. Don't stop it simply because the reason as to why you don't need to stop it now is because you are given that drug to be using it, but it is going to just relieve. Yes, when we give it to you, we are giving it to you to relieve the blood pressure, but we want to treat it. We want to treat it. Since it is a lifestyle disease, please, we can also treat it by lifestyle. Thank you so much. Contact me so we can help you the more. Follow, share, comment. We can always help you. Thank you.